thank you very much, Mike and Tito, for inviting me to present today. It's an honor for me speaking to such interesting audit. Today, first, we will try to understand better why it's important using process mapping in the healthcare sector. Then we'll provide an overview of what process mapping is and its origins. And then we will discuss about how process mapping is being used in the healthcare sector. I will then provide you with some guidance to effectively conduct process mapping exercises. And finally, we will discuss benefits, success factors, and challenges of using this method in the healthcare sector. Many samples in everyday life show us that systems are designed to get certain outcomes. And if we want to change outcomes of a system, we need to change something in the system. But are you sure to know how the system you daily deal with works in reality? For example, look at this picture. How does the system work? Looking in this picture, it's clear that people are not using the path in the way the city planner intended. So people have adopted this little system to work better for them. For example, people with a buggy will use the main road, while people with trainers might have walked on the grass to shorten the path. I'm sure that this behavior is not uncommon for those of you that work in healthcare. So busy and dedicated healthcare professionals who do what they need to do for the best of their patients. And sometimes it's not as the system has been designed. Healthcare is provided by many different people who carry out various tasks to deliver patient care. These tasks are often related to and dependent to each other. What often happens in our experience is that often people think that systems in which they daily work in behaves in a way which is completely different from reality. Healthcare systems are complex and characterized by a high number of diverse stakeholders, each having different background, objectives, and interacting in a context characterized by high specialization and rapid advancements in knowledge and technologies. As a consequence of this complexity, we have that most observed failures in healthcare may be ascribed to system and process criticalities rather than to human errors. And to tackle this challenge since 1980, governments and healthcare organizations have shown an increased interest in the adoption of management practice and technology already successfully adopted by other industries, such as business process management practices, lean manufacturing, Six Sigma, and the use of modeling and simulation approaches. All these techniques require a deep understanding of the system and processes under analysis, which is usually provided by process mapping. Now let's see what is process mapping. So process mapping is a method which allows to identify and expose key elements of a process and to gain insight into actual practice, as well as to design new or enhanced processes. Process mapping also allows to analyze and better understand the systems and processes in which improvement interventions might be introduced. Process map breaks a process down into steps. Common symbols used to represent process maps are ovals for start and end points, rectangles for activities, and rhombus for branch points. I'm sure all of you played Monopoly at least once. So this is an example of a process map for a turn in the game of Monopoly presented by Donald Wheeler in his book. So the game starts when the participants receive a dice, then the participants check whether they are in jail, and if they are in jail, they want to decide whether they wish to pay a fine, and if they don't want to pay a fine, they may want to roll a dice, and so on and so forth throughout the process. Here you can see an example of what can happen when seeking advice in primary care. So the process starts when a person feels unwell. And then they can decide whether they want to ring NHS 111, and then if they decide to ring NHS 111, they can call and listen advice, self-care, go to the pharmacy, and hopefully feel better. If they decide to don't ring the NHS 111, they can decide to ring the GP. And if they don't want to ring the GP, they can self-care and hopefully feel better. While if they decide to ring the GP, they can ring and make an appointment, and so on and so forth throughout this process. As you can see, this process has a clear starting and end point. Okay, now let's see what are the origins of process mapping. So Frank Gilbert in 1920 at the American Society of Mechanical Engineers annual meeting introduced process charts, defined as a device for visualizing a process as a means of improving it. In 1947, the American Society of Mechanical Engineers established a set of symbols derived from Gilbert's original work as the standard for operation and flow process charts. Following Gilbert's work, Alan Morgensen described process charts as an irreplaceable tool and the lifeblood of work simplification, and used them to organize and analyze work. Then Morgensen's students, Ben Graham, adapted the process charts from the factory to office information flows. And then the popularity of process mapping technique has rapidly increased in the manufacturing field as well as in some service industries, and involves many application domains. But despite the potential advantages, there is still little evidence on the use of process mapping in healthcare compared to other industries. Therefore, during my PhD research, I conducted a systematic review of literature and an empirical study on the use of process mapping in healthcare. In the systematic review, I reviewed methodological literature and 105 empirical studies with the objective to identify the context of use of process mapping in healthcare improvement projects, develop a conceptual framework identifying the phases of process mapping with quality criteria for each to guide the implementation, assessment, and reporting of this method. Then I also assessed the consistency of these quality criteria with which the method has been applied. And finally, I also identified the evidence of the benefits of using process mapping in improvement work. So we found that in healthcare, process mapping is used in a variety of settings, so in patients, outpatients, primary care, public health. Sometimes it is used as a standalone methodology, and at other times as part of other quality improvement approaches, such as Lean, Six Sigma, failure mode, and effect analysis. Process mapping is also used widely within operational research techniques, such as modeling and simulations, or to inform the design, development, and evaluation of health information technologies. It can also be used for costing analysis, for example, using time-driven activity-based costing technique, or to represent evidence-based pathways as well as patients' experience. By reviewing this literature, we also developed a conceptual framework outlining quality criteria for each of the 5 phases characterizing a process mapping exercise. So the first phase is preparation, planning, and process identification. The second one is data and information gathering. The third is map generation. The fourth, process analysis. And the fifth, take it forward. We will get back to these phases in a minute. Then we assessed empirical literature against the quality criteria, and we found poor compliance in the application of process mapping, in particular in terms of training the team on the use of process mapping tool, poor involvement of patients' representative in the project, and also poor use of charting software to draw the process maps. In general, our findings demonstrated that a greater rigor in the application and reporting of process mapping method is required. Okay, now we have seen why process mapping is important, what is process mapping and how it is used in healthcare. Now I will illustrate some good practices recommended for a successful process mapping exercise throughout the 5 phases of a process mapping exercise I mentioned earlier. Okay, let's start with the first phase, so preparation, planning, and process identification. Before starting a process mapping exercise, you should really understand what the aims of the project are and why are you using process mapping. So what are you trying to achieve and which part of the process or patient group you need to focus on. Then, in order to achieve a realistic understanding of current system, it's crucial to involve the right people having diverse roles in the process and diverse perspectives and knowledge of the system. Therefore, at this stage, it's crucial to identify and engage the right stakeholders and make sure that patients are represented in the project group. Then, in order to increase attendance of as much as busy people as possible, it's good practice to carefully organize the sessions, plan meetings in advance, and finding a suitable venue. Finally, in order to get the most from people's time, it's important providing them with basic training on process mapping. Now let's move to phase 2, data and information gathering. Before starting to map, it's important to collect data and information about the process to better understand the process. This can include literature or empirical data, such as questionnaire studies of patients' expectations and outcome, or more operational data, such as process steps, activity durations, activity costs, or resources involved. And in order to collect the right information, it's important to understand what type of information you need and where are you going to find it. Then it's important to develop the data gathering plans and using data gathering tools which are appropriate to the type of data we are collecting. In fact, different types of data can be collected using different techniques. For example, we highly recommend using multidisciplinary meetings, but other methods might include direct observations of patient journey, one-on-one interview, reported patient's experience, document analysis, and a combination and triangulation of these approaches is also common. Then you need to map the process. So there are many ways in which this can be done. However, the most effective way to get everyone involved to share their perspective is the so-called big room approach, in which all participants work together to build the process map and have the opportunity to share their perspective and knowledge on the process. Then when you draw the map, you need to choose the right level of detail on the basis of the scope of the process map. So you don't need to put effort in drawing a very complex and detailed process map if you don't need it. Then you need to decide whether you want to draw your map by hand onto paper, or you want to use sticky notes to generate initial activities, or if you want to use mapping softwares. You also need to decide what modeling language you want to use to represent your map. Then in general, you should be careful to focus on the as-is process map and don't try to solve the problems until you have fully mapped the process. Finally, I recommend also to use a simple approach and encourage honesty by creating an environment where people feel safe to share their thoughts and feelings. Here, an example of how the same process, having breakfast, can be represented through a high level, or in this case, a very detailed process map. As I was saying, you can use different modeling language to draw your process map. Where a modeling language is constituted by a set of symbols that you use to represent your process and their semantic. Of course, this will depend from your objectives, type of analysis and skills of people involved. This is an example of flowchart, which is widely used in healthcare as it is easily understood also by people with a weak technical background on process mapping. This is an example of value stream mapping that is often used in Lean Six Sigma projects, as it focuses on operational information such as resources involved in each activity, activity durations, delays in the process. And this is an example of BPM. I'm sure many of you are familiar with it. This is a more structured modeling language, usually used to model information flows and used as the basis for designing information systems. Once you have mapped this process, you need to analyze it in order to identify gaps in the system and opportunities for improvement. There are different types of analysis you may want to perform. For example, quality, efficiency, cost, depending on the scope of your project. You can annotate your process map with information derived from your analysis, and it's good practice in case you have paper-based process maps to make a tidy version by transforming them to an electronic format using Charty software. This would allow you to share the process map more easily with stakeholders and experts for validation and dissemination. This is an example of how information derived from the analysis can be annotated on a process map. For example, this process map was annotated with information regarding patients' experience throughout the process, and also we use different colors to highlight activity with high risk of failure for doctors and for nurses. In this example, the scope of the map was to calculate costs on the basis of the duration of the activity and personnel who performed each activity. As you can see here, each activity has been annotated with information about the activity duration and has a different color depending on the personnel category that performs that activity. Okay, after sharing the map and asking for comments and validations to key stakeholders, it's important testing improvement ideas in practice. Improvement ideas identified in the process mapping exercise become an integrated component of the Plan, Do, Study, Act cycle for improvement. And I want to highlight here that a common mistake is using process mapping only at the start of an improvement initiative, while it's good practice using this method to guide process improvement in the initial stages to identify and prioritize ideas for change, but also throughout the process to monitor change and at the end to evaluate the impact. Okay, just to summarize the main concept we learned so far. In order to improve system, we need to understand how this system behave. Often knowledge about complex systems, such as healthcare system, is fragmented across many different stakeholders. Process mapping is a method that allows us to understand how systems work in reality by gathering perspectives from these different stakeholders involved, each seeing a different bit, each having a different perspective on the process. Process mapping therefore allows us to have a more realistic and shared understanding of reality. As I was mentioning earlier, I also conducted an empirical study aimed at understanding the main benefits achieved by the use of process mapping in healthcare practice and the main success factor of process mapping within improvement projects. In this study, I conducted qualitative interviews to participants having different backgrounds and roles within 8 project teams in the NHS. Participants reported a series of benefits regarding the use of process mapping in healthcare, which mostly overlapped with what I found in literature. We found that process map is a key method allowing you to break down the complexity of healthcare processes, to develop a shared understanding of local system and practice, and to provide a structured visual picture of reality. Process mapping allows to support the continuous cycle of improvement by informing the scope, design, development, and evaluation of interventions. Finally, process mapping is key in supporting consensus and agreement toward shared solutions and motivating people to change. Process mapping has been reported to encourage a culture of ownership and responsibility for improvement work, and this is seen as a useful tool to facilitate dialogue between diverse stakeholders. From this study, we also identified the key success factors for process mapping within quality improvement projects. We found that information should be gathered from multiple stakeholders. We also found that the visual representations in process mapping should be simple and appropriate to the audience to engage everyone in the process. We also found that the facilitator's experience and soft skills are also crucial to get the most from this exercise. Basic training for people involved is also important. And as we said, it's advised using process mapping iteratively throughout the project. Key challenges of process mapping in healthcare emerging from this study are related to the difficulty of involving and engaging frontline staff and patients in the process mapping exercise. And when using operational research and simulations technique, the main challenges are related to the communication gap between process analysts and other people involved due to different background and language. Also, another difficulties is related to lack of data to support analysis. Sometimes we have very few data, or data are often, for example, in hospital, you for sure will have this experience. So data are spread across different information systems, and it's difficult to put them together to actually do a proper process analysis. And limitations are also related to technical skills, which enable team members to interact with the process analysts. Therefore, to run a successful process mapping exercise and get the most from its use, we need to identify and engage the right stakeholders, including patients. Experience and soft skills of facilitators are key to the success of process mapping. The ability to use a simple approach and create a safe and trusted environment where people feel free to share their experience, emotions, and even failure experiences without feeling judged is key. And this would allow the social benefits of process mapping to be achieved by increasing empathy with colleagues, engagement in the project, identifying agreed solutions, and reduce barriers to change. I just would like to conclude with some practical suggestions to improve the use of process mapping in practice. First, I would suggest using the guiding principles we talked about today when planning and implementing a process mapping exercise. Then using an approach to process map as simple as possible and near to the needs and language of clinical staff is also very important. We have also seen that often patient perspective is not embedded in process mapping exercise. So I would suggest paying greater attention to patient involvement in this type of activities. Then to get the most from this method, it's important using process mapping iteratively throughout improvement projects to plan the interventions and progressively compare achievements. Finally, but not less important, I believe that while encouraging analysts and information system designers to develop and adopt simple and user-friendly approaches when dealing with the healthcare environment is key, on the other hand, I believe that training clinical staff on quality improvement methods and their inclusion in the academic curricula of healthcare professionals could really make a difference in trying to effectively use in the healthcare setting process mapping, but also other quality improvement methodologies already widely adopted in other industries.